I'd like to introduce Dr. Richard Nahas, the founder of the Seekers Centre in Ottawa, Canada. Thank you for joining me, Richard.
Thanks for having me.
Could you tell me when you first heard about LDN?
When I began thoughts about setting up an integrative medicine practice, I spent time with experienced integrative medicine physicians in a number of places in North America.
Mm-hmm.
And LDN came up twice. And both of the doctors who had been using it reported very good results. And that's one of the forms of evidence that we sometimes rely on in integrative medicine is good experiences from our colleagues.
Mm-hmm.
So that was about 7 years ago, and I've been using LDN ever since.
Mm-hmm. What conditions do your patients have that you treat with LDN?
I see a wide range of problems because people tend to seek out integrative medicine when conventional approaches have failed.
Mm-hmm.
So I see allergies, I see autoimmune disease, and I see cancer and chronic fatigue.
Mm-hmm.
Those would be the categories that I would most often use LDN with.
And what kind of results are you seeing?
In general, very positive in terms of patients who have had LDN alone. We probably have 30 to 40 of those. Most of our patients undergo a multifaceted treatment plan. So it's hard to tease out exactly what was attributable to a specific medicine. But I have had patients who've come asking for LDN by name and who have only used that.
Mm-hmm.
And I've had fairly consistent improvements in sleep. Some of the patients have had prolonged sleep difficulty on the 4.5 milligram dose, and when we use the 3 milligram dose, the sleep troubles go away. And then we can bring them up to 4.5 a month later or so.
Mm-hmm.
But other than that, I haven't had any real side effects. And I would say 2/3 of patients report an improvement of some kind.
Mm-hmm. And what have you noticed pain-wise with people? I mean, have you had patients come to you that are on opiates and have to be weaned off before they start LDN?
That's a difficult category because it's a challenge to get people off of opioids.
Mm-hmm.
But about a year ago, we developed a protocol using ear acupuncture to turn off the withdrawal symptoms.
Mm-hmm.
Some of your viewers may have become aware of laser ear treatments to treat smoking addiction. And there's a protocol using points on the ear that is used in patients with a wide range of addictions, but I think we're the first to use it to get people off of opioids. So now that we're able to do that, we can use LDN in a broader range of patients.
Mm-hmm. Well, I hadn't heard of that before. I mean, is it really successful? Does it take long?
Well, I've actually found that it is more effective than I had hoped, because in some cases I've been able to get patients off of benzodiazepines. Like these are the family of Valium and diazepam, lorazepam, clonazepam, etc.,
Mm-hmm.
which traditionally we're taught patients can't come off of without an in-hospital detox program. And in some cases, patients have been able to come off those drugs in one treatment.
Wow.
And the same with the narcotics. But in many cases, patients are scared to do it in one session, so we'll often spread it out over 3 to 4 sessions a week apart.
Mm-hmm. Have you any other case studies you'd like to tell us about?
Well, I think that the only thing that I could share that would be perhaps interesting or different from what you might hear from other clinicians is that I found much more benefit in a handful of patients with pulsing the dose. So I take patients off it for a week every month.
Right.
And that's basically based on keeping the body guessing so that the body doesn't become used to specific level of endorphin production. And I wish I had the kind of infrastructure in my clinic that my hospital-based colleagues have, so that I could gather statistics and publish results. But I could say that 6 or 7 patients have found that in the first 6 months of using LDN, they got a certain degree of benefit. And then we went through a phase of 3 months where they would do 3 weeks on, 1 week off, 3 weeks on, 1 week off. And they found it to offer additional benefit. I don't know if any of your other clinicians have reported using it in that way.
Dr. Bob Lawrence used to do 10 days on and 2 days off, but he actually stopped doing that in 2005. But
Interesting.
In Canada, if anybody wanted to come and see you for LDN, do you take people from a certain area, or can people just travel from anywhere and come and see you?
Yeah, basically, I only need to see a patient once per year.
Okay.
To feel within the scope of my professional responsibility. If they're a patient that's stable, not on narcotics, obviously, who's got a sort of a stable disease picture, a problem that's been around for more than just a few months, something that is established, and they've done the reading and they know what to expect, then I'm comfortable just being there as a gatekeeper to a treatment that I think more people would benefit from.
Well, we could certainly use more doctors like you, and thank you very much for sparing the time to speak to me.
My pleasure. All the best.
Now,
my pleasure. All the best.